Well, I started to be interested in public reporting because I think it's one of the connecting links for different disciplines, and particularly because of all the work that has been done in evidence-based medicine. This would actually reconnect what's the scientific background with the rights of the citizen to actually know how taxes are going to be spent in public systems. And I guess this is one of the historical moments where through the modern technology we can shape the future of public reporting in ways that could actually also be tested to be effective for outcomes improvement. And there's a lot of work done internationally on linking such information on performance management and also creating standardized platforms so that there will be only validated methods to be applied for public reporting. I think one of the most critical is actually to make an active use of this information, so that it's not just, let's say, the yellow pages of health information or maybe health systems, but this information could actually be used to improve health services. And to make this possible, since this is happening just not only because of the scientific push towards the usage of this information, but also because the people, the professionals, the doctors, many different type of users are making pressure for making this happen. We have to make sure that also the way to communicate is effective. So one of the key challenges, I think, is also creating interfaces which are strong enough but also easy to use. I mean, I think that if I could summarize it, for instance, policy level, I'd like to see health ministers for all countries to be able to actually use their mobile to make substantial use of this information for their work, considering that many policymakers may not be necessarily specialists in the clinical sector, but have to make important decisions. So I think this information has to be critical for choices to be made by the public and the policymakers. Today we have to link the background, the clinical background, and strong steps ahead that we made in the 90s and in 2000s in evidence-based medicine to the definition of priorities and linking to some of the key methods we have in statistical techniques, but also the legal background that is needed to make sure that this information could be exchanged and put on portals or various means without breaking the rules of privacy. This is one of the key issues that would define essential levels, because we just cannot use all health information that's out there. But we have to also make sure that privacy legislation is not acting as a barrier to the usage of health information. So the definition of essential is very much a political issue as well. And I would like to see also different types of policymakers discuss with high-level experts, also internationally, to decide how these essential levels could be exchanged and then placed on public portals and engines that could be used by different types of users. Australia has a lot to learn, not much I think on the technical side, because Australia is very strong on technical matters. It's done quite a lot actually in the past to deliver this kind of information. But I think that Australia has to learn a lot about collaboration and routine activity with international partners. I see not so present as it should. And I don't think it should be only a matter of cost for travel or obviously the effort that has to be made for traveling, but I think it has to be determination in collaboration, because there is a lot about best practices that could be learned each other, not only unilateral, but both sides to actually exchange best practices. I think this is something that probably hasn't been realized so much, particularly from the national Commonwealth level. More should be done. Teaching is always a difficult term, because it's very much always a kind of mutual exchange. But I think that Australia has really a lot to offer, particularly in relation to usage of data linkage at state level and the type of formal coordination that's been put by agencies and departments of health in several states such information is not so much delivered internationally, and all the activity on national classification systems, just to mention one, the Australian DRGs, which have been implemented in several countries, even in Europe, helping out, for instance, to establish the German DRGs and other related activities. Well, this could be brought to the construction of better indicators, performance indicators in particular, and there's a lot that other countries can actually learn from coding and quality improvement in data systems. I think this is one good reason for Australia to travel and for Australian colleagues to be part of the international collaboration.